Today, I'm going to show you how to do an intramuscular injection, how to inject medicine into your muscle so it gets into your systemic system right away. It's the most common way that men administer testosterone injections. It's what I recommend to almost all my patients. So first thing you do is let's get our supplies together. You're going to need your testosterone, which usually comes in a vial in a box like this, a vial adapter, which will attach to the testosterone vial to make it easier to draw out the medication, a 1 milliliter syringe, and a couple of needles. You'll have a 25 gauge needle to do your intramuscular injection with, and you'll also usually get an 18 gauge needle in case you don't use the vial adapter. You can use an 18 gauge needle instead. It's just personal preference, but I'll show you how to do both today. Obviously, you need a couple alcohol swabs. We want to keep everything sterile and clean. So, step one, take out your medication, your testosterone. Come in a box like this. The first time you open it, pull it out, you'll notice it's a big vial and it's got a cap on it. This is a multi-dose vial. And what that means, you're going to get multiple doses out of it. So we're going to reuse it. Good news is it's easy to store. It doesn't need to be in a refrigerator or kept out of sunlight or anything. I just put it in the medicine chest with all my other medicines. But the first time you get it, it's going to have a plastic cap on it that you just need to pop off. Just like that. Then every time you use this, you want to make sure you clean it off with an alcohol swab. So I'm going to take my alcohol swab, wipe off the top, and on the top there's a little gray rubber stopper, and that's what we're going to pierce through to get to the medicine. So I cleaned it off with alcohol swab, good to go. And then we attach, one time only, but we attach a vial adapter. It comes in a little package like this. Open that up, pull out the vial adapter. And this is what a vial adapter looks like. And it has a blue cap that you'll attach your syringe to, and a sharp prong on this end that goes into the vial. There's a cover on it right now, so I'll make sure you pull off this plastic cover. So you notice there's a sharp prong on the end of the vial adapter, and you just use that sharp prong to pierce through the vial all the way in, and it stays in place like this. Doesn't leak out, it's attached nice and tight. This vial adapter attaches to the vial one time only, stays on there. When it's empty, the whole thing gets thrown away. The nice thing with the vial adapter is it attaches to the vial, and now every time you go to do your injection, all you need to do is take your syringe, screw it on, pull back your dose, and good to go. So let's do that. We're going to take your 1 milliliter syringe, open that up, and you notice your 1 milliliter syringe, it is marked in increments of 0.1, 0.2, 0.3. My dose today, we're going to say is 0.8, so I'm going to pull back to the 0.8 when I do my dose. The syringe is threaded, and so is the vial adapter. So the syringe is just going to screw onto the vial adapter. I want to make sure it's clean, so I'm going to take an alcohol swab, clean off the top of the vial adapter. You'll do that every time you load up your syringe, and then push the syringe on the vial adapter, screw it. It usually takes about a quarter of a screw, and it's tight, it's on. It's not coming off. I can turn it upside down, all good. And then I'm going to pull back on the plunger to 0.8. That's my dose. I'm measuring from the top of the black plunger. So I'm going to pull slowly, and you'll notice when I start pulling back slowly on there, some oil fills up into the syringe. And it's an oil. It's thick. So if I pull back too quickly, what happens is I get a big air bubble. All good. I just push that air bubble back into the vial and start off pulling back a little more slowly. Now I'm looking for the top of the black plunger to get to the 0.8 mark on my syringe. There we go. Check. We're good. Then I unscrew the vial adapter from the syringe. Again, about a quarter of a turn. And I can set this aside, put it in the medicine chest with all my other supplies for the next injection. And now I want to attach my injection needle. The injection needle is usually a blue needle, and it's a 25 gauge needle. It's pretty small. So I want to open that up, pull out the needle. And again, syringe is threaded. The needle just attaches and screws about a quarter of a turn till it's nice and tight. And then when you go to do your injection, the cap pulls off. It doesn't screw off. It just pulls off like that. Then comes the injection. 2 locations for an injection. The 2 biggest, strongest muscles in the body are your quads and your glutes. So your thigh muscle or your butt cheek. That's where I recommend. Obviously, we've all probably gotten a shot before, say the flu shot, and it's in your arm. But good reason for that. It takes pretty much taking off your pants to get a shot in your butt cheek or your leg. So much easier just to roll up your sleeve when you go to CVS for your flu shot. But A muscle is a muscle. I just recommend the biggest, strongest muscles in the body because best absorption, least amount of pain. So I recommend the thigh or the gluteal muscle for an injection. We'll start with the thigh. To do an injection into your thigh or quadricep muscle, you want to identify the muscle. Now, the best spot on the thigh is the outside muscle. So technically it's called the vastus lateralis. So I think the best way to do a shot is sit down in a chair, relax. That way your feet are on the floor and you're relaxed, the muscle is nice and relaxed. But to identify the thigh muscle, I straighten my leg and flex, kind of like you're doing a leg extension at the gym. And you can see this outside thigh muscle here. This is your vastus lateralis, this outside quadricep muscle. All of us can straighten our leg, and if you can't see it, you can at least feel the muscle nice and firm. That's my muscle. And I want to give my injection halfway between the knee and the groin. So kind of the midpoint is going to be the best target. It's okay if you get a little closer to the knee, a little closer to the groin. Everybody's a little different in where they like to do it, but right about the middle of the muscle is the best target. And remember, it's not straight up and down or on the side. It's kind of at a 45-degree angle, the outside thigh muscle. So I'm kind of pinpointing where my injection is going to be. Got it. And now I'm going to relax my leg, and I'm going to clean off the area with an alcohol swab. So I take my alcohol swab, wipe off that area identified, and then got the identified area. I'm going to pull off the cap. Again, the cap pulls off the needle. It doesn't screw off. Set that aside because you'll need it later. Don't throw it away. And then hold the syringe like you're holding a pen, dart, index finger and thumb, middle finger and thumb, whatever you're more comfortable with. You can even do both. I'll do both. So I'm holding between my thumb and my index finger and middle finger. And then I'm going to identify that spot again. I like to kind of use two fingers. That way I'm kind of aiming between the two fingers, and it helps pull the skin tight. If you have a lot of skin on your leg, it helps kind of pull the skin tight. And then just like you were trying to pop a balloon with this needle or this dart, if you will, you're not going to go real slow to pop the balloon. You want to give it a little intention, a little oomph to get it through. It's like pulling off a Band-Aid. You never want to do it slowly. So I'm going to hold my syringe with my needle about an inch away from my skin. 1, 2, 3, in. It goes in all the way. And then I can use my non-dominant left hand to hold the syringe and use my dominant hand to push on the plunger. Now I'm going to push slowly to the count of 10, 9, 8, 7, 6. This is a thick oil, so it takes a little while to go through that tiny little needle. So you don't want to rush things. I know we're in a hurry to get this thing over with because I just put a needle in my leg and you're like, oh my God. But just take your time, count to 10. Once the plunger is all the way down and you're good, then just as quickly, pull the needle out. And if you get a little drop of blood, all good, you can just wipe it off. And then I always recommend massaging the muscle for 15, 20 seconds. That helps stop any bleeding if you get a tiny drop of blood like I did. It also helps distribute the oil into the muscle and can prevent soreness. And then all good. Can barely see where it was. An intramuscular injection into the gluteal muscle or butt cheek takes a little more dexterity. You're going to want to hold the syringe between your middle finger and thumb. That frees up your index finger to push on the plunger. The location for your shot is your butt cheek, the whole gluteal muscle. However, the easiest location to identify is kind of the upper outer quadrant of the butt cheek. Think of it like where you put your wallet in your pocket, kind of where your back pocket is. So easy enough to the muscle right below your belt line. If here's my belt line, right below it, this is all gluteal muscle here. So just identify the glute muscle right about there. And as always, first thing I want to do is clean it with an alcohol swab. So just wiping off the skin, make sure it's nice and clean. And then removing the cap. Remember, it pulls off, doesn't screw off, and you're going to save that. And then hold between your index, your middle finger and thumb, upper outer quadrant. Hold it so that my thumb is right about halfway or so, wherever you're comfortable on the barrel. My index finger needs to be on the plunger to push it in. So 1, 2, 3, in. Push it all the way in, so it's all the way into the muscle. And then to the count of 10. 1, 2, 3. Definitely need to have a little bit more flexibility or dexterity to reach over your shoulder to do the glute muscle. Once it's all the way in and the black plunger is all the way down, I pull it out just as quickly. Pull it straight out. And then can take a little gauze or tissue if you need to and massage the muscle to help distribute the oil. And again, you may get a drop of blood, all good. If you inject into your thigh or into your glute muscle and you see a drop of blood, that's fine. You're never going to hit an artery, a nerve, or a big vein because those are much deeper. So not to worry about that. The other thing to remember is before you throw away your syringe and needle, make sure the cap goes onto the needle. Again, it's like putting a pen cap onto a pen. You don't put the pen into the cap. So I put the pen cap onto the pen, it clicks in place, and now this whole thing can go into the trash, good to go.